welcome to you all to this webinar. This is EIZOC Ophthalmic Research and Publication Initiative, and the topic is writing a thesis protocol. I welcome our mentor, Dr. Chaitra Jaydev, Chief Coordinator, Dr. BNR Subudhi, Chairman Scientific Committee EIZOC, Dr. Sabyasachi Patnaik, then Secretary EIZOC, Dr. Swaraj Bhattacharya, Coordinator, Dr. Santosh Maharana, Advisor, Dr. Ajit Babu Machi, Moderator, Dr. Prafulla Maharana, Co-Moderator, Dr. Chandana Chakravarti. I especially welcome our speaker, Dr. Neha Goel, and I welcome all these panelists and discussants to this webinar. So this webinar actually is very useful for the beginners, for research programs, and they will definitely be most benefited. This is really good academic activities, and for this step, I thanks a lot to all the initiators, Dr. Subudhi, Dr. Sabyasachi Patnaik, and all others for this special program. I thanks to our mentor, Dr. Chaitra Jaydev also, and advisor, Dr. Ajit Babu Machi, and all panelists and specialists and discussants. So with this much of I hand over to Dr. Sabyasachi Patnaik, our Chairman Scientific Committee.
Thank you, sir. Thank you very much for your presence and enlightening us regarding the activities that EIZOC is conducting under your leadership. Now I request our Secretary General of EIZOC, Dr. Swaraj Bhattacharya, to speak few words and encourage us.
Thank you, Dr. Sabyasachi, and good evening, everybody from the EIZOC Secretariat. We are here again together for being a part of the webinar EIZOC Ophthalmic Research and Publication Initiative, ORPI Webinar Series 2. This will be giving us a guideline for the young generation to come up with a research and publication initiative, which in turn will improve the academic activities. And as a whole, this type of program, the bond between the states of EIZOC will be tightened. Through the EIZOC, Eastern India is gaining its position and repute in the National Ophthalmic Forum. Our Chairman Scientific Committee has framed the webinar in such a meticulous way, supported by our Chief Coordinator, Dr. BNR Sir, and Dr. Santosh Mahapatro. Advisor, none other than Dr. Ajit Babu Machi, past AIS President. We had, in addition, already been explained by our President, we had so much of galaxy of panelists who are the masters and authority in the field of scientific publishing, led by Dr. Vibhuti Sinha, Dr. Suchitra Pariza, Dr. Sharmishta Behera, Dr. Pragyan Panda, Dr. Pushpa Kumari. Also, we had a good number of young ophthalmologists who will be discussing of the program, and their interaction will surely make the program a successful one. We plan to do this type of webinar regularly. In addition, our Chairman ARC, Dr. YC Meti, also planning to have few ARC activities. Just for the information, our midterm conference will be on 27th and 28th August at Port Blair. And those of us yet not registered, please do it immediately and be a part of the great event. Thank you, and over to Dr. Sabyasachi.
So thank you, Sarasda, for your comments about EIZOC and the activities that we are undertaking under your leadership. Now I request our Chief Coordinator, Professor BNR Subudhi, to start today's program.
Thank you, Dr. Sabyasachi. Let me share the screen. Good evening. Welcome you all to our second program of ORPI. This is a really wonderful thing. Today we had a series of speakers, moderators, panelists, and I think above all the discussion students. So I won't take much time. Today's mentor, Dr. Chaitra, has she joined? I think Dr. Chaitra has joined.
Yes, sir. Yes, I'm here. I'm here.
You're there? Okay.
Show your face, madam. Show your face.
Mentor of this
No,
program is
sir,
always
I'm
Dr. Chaitra.
driving. Sir, I'm driving. That's
Yeah,
why.
please.
Sorry.
The Chaitra is our mentor for the last, I think, few months. It was earlier, it was in the simple RP. Now it is get the broader platform, EIZOC platform. And these are the EIZOC stalwarts already has been told by our president and secretary. Advisor, without advisor, nothing works. And I think that Rajibabu Maji, the best advisor for all of us in all our RP and ORPS programs. Yes, already told as today's moderator being Dr. Papula Mahana. I think everybody knows about Dr. Papula Mahana. He's our son of the soil. He's the faculty at AIMS, Delhi. And of course, Dr. Chandana Chakravarti, I think everybody knows in EIZOC and nationally. She is now at the RIO, Kolkata. They are the moderators for this program. Of course, the main star attraction is Dr. Neha Goel. I think today I had a really tough time because when I received a biodata for hers, it's a 47 pages. I was really wondering what to keep, what to not to keep, and it took a lot of time today. I was very much tense. I'm sorry if I missed something, Dr. Neha. So I welcome you all. I welcome you to this program, today's program, and to tell briefly about her biodata because hardly she has crossed 40, but she has got 47 pages of her biodata. It's really wonderful. We don't have it lastly 3-4 pages only. So Dr. Neha is the MBBS, MS, DNB, MNMS, FRCS. She is currently working as co-founder, director, senior consultant, Vitretina and Uvia, Tetraview Super Specialty Eye Center, New Delhi. And her husband is also an ophthalmologist, posted as assistant professor, AIMS, RP Center. She has completed MBBS from Maulana Azad Medical College and MS at Guru Nanak Eye Center, Delhi. She has completed MS in 2009. Subsequently, she did FRCS. And in this short span of time, within hardly 10 years, she has published 92 PubMed indexed publications and 27 non-indexed publications. It's really amazing. And her presentations also, she had 28 international presentations, 34 national presentations, and 28 state presentations. At present, she is working at also assistant editor to EIZOC from 2017, and she worked earlier also from 2015 to 2017 in the Delhi Journal of Ophthalmology. She had a lot of awards. Few are there in the, of course, in her biodata. She had best case present in the IIS conference not only once, several times. Best paper award in SAR conference 2008. She had written several chapters in many of the ophthalmic books. Member of various professional bodies, national, internationally. She's a reviewer of EIZOC, AJO, and I. And she has rendered a lot of community services in spite of her busy clinical practice and writing papers. Really, it's amazing again. She's involved in several clinical trials. I cannot name them. There are about more than 10 clinical trials going on. And she's invited faculty for various national conferences. So really, I'm present before you, Dr. Neha Goel, a wonderful young lady. And I think she will justify her inclusion in today's webinar. And of course, our panelist already, our EIZOC secretary has already said, Dr. Vibhuti Sinha from Patna, AIMS, Patna RIO, Dr. Sarvishta Behra from Bhimsar Burla, and Dr. Pragya Panda from MKC Medical College, Professor HOD, Dr. Pushpa Kumari from IGH Raurkela, and Dr. Suchita Pareja, head of the department, AIMS, Bhubaneswar. And these are the young students, I would say the young residents who are very much interested to participate in this webinar. Dr. Tausif Nazin from Dibrugarh, Dr. Mosum Mant from Raurkela, Dr. Aishwarya Bhatt from Cuttack, Dr. Abhinav Agrawal, Dr. Chandra Prasad, Dr. Smrutika from Bhubaneswar, High-Tech Medical College, Dr. Sipa from Bhubaneswar, again Dr. Sriya from Parampur, Dr. Amit Bidasaria from Rotary Cuttack, Dr. Pooja Patnaik Bhimsar, Dr. Juhi Gupta from RIO Kolkata, Dr. Kopal Srivastava from AIMS Patna, Dr. Aditya Ranjan from AIMS Patna, Dr. Anmol Kaur, AIMS Bhubaneswar, and Dr. Kumari Priyanka Verma from RIMS Ranchi. I welcome you all to this webinar. I would say that please be interactive with the speakers, panelists, and don't stay silently. So these few hours, I thank you again. Back to our mentor before we start the program. Mentor to say a few words. Dr. Chaitra, it's over to you. If you are there.
Yes, I'm here. I just want to say thank you for having me, contribute to EIZOC in this way. It's a pleasure, and it's great to be part of ORPI, the second series. I think with ORPI 1, we covered a lot of it, right from the basics of writing, literature search to everything. I think we even had a couple of workshops on how to plan a study. So I think we did fairly well with ORPI 1, and I'm sure ORPI 2 will take it to the next level altogether. And I'm so glad that Dr. Neha is part of this. She's a wonderful speaker. She's got a lot of experience, and I'm sure she's going to contribute a lot. So welcome all of you all to our program. Thank you. Over to you.
Thank you. Dr. Ajit Babu, before Dr. Neha starts his speech, 1 minute? No?
No,
okay.
I think let's
Neha,
not
now
waste
it is
time.
over to you. Dr. Neha, it's over to you. Next,
No, somebody, Pooja has to present, no? Yes?
Yeah, before Dr. Neha, I think Dr. Pooja has to present. Dr. Pooja, be brief in your presentation.
What you have prepared, how you have prepared your thesis protocol, just explain.
So actually my topic is awaited. It hasn't been finalized by my guide, so I'll be going with overall general presentation about writing a thesis protocol.
What you have thought of, that also you can discuss.
Yeah.
Then basing on that, Dr. Neha will discuss each and every component in detail.
Yes, sir. Good evening, everyone. Of candidature for an academic degree or professional qualification that presents the author's research or findings. The main difference between thesis and dissertation is the size of the study. Thesis is the smallest study size of a particular topic, whereas dissertation is the largest study of the same topic, where synopsis is a common name for thesis protocol, and it is a short systemic outline for the proposed thesis that has been done by keeping in mind the first presentation with the supervisor. Now, the term graduate thesis contains both doctoral dissertation and master thesis, because thesis is mostly used in a bachelor's or master's degree, whereas dissertation is mostly used in a doctoral degree. Now, the format for writing a thesis protocol. Now, the first thing is the title page. This is a concise statement of main research topic. It contains the title of the project and the investigators of the project. That is the principal investigator, the guide, and the co-guide. It has to be clear, concise, precise, attractive, unambiguous, and should contain 12 to 15 words. It should be written in title case, that is all words in capital, except the articles, prepositions, and keynotes. Not right is A better than B in the title. There should not be any symbols in the title. For example, if I'm using beta blocker in my title, so I have to spell beta instead of using the symbol beta. I cannot use any abbreviations in the title page. If any numbers are to appear in the title, and if it's a single digit, I have to mention it in words. And if it is 2 or more digits, then we can mention it in figures. Like you can say 9 cases where 9 is spelled, whereas in 256 patients, we have 256 in figures. Now, if living things are mentioned in the title, the genus has to be capitalized and not the species, and the whole thing should be in italics. Like you can see in Staphylococcus aureus, the S is in capital and the whole thing is in italics. We may also highlight the study type and the design if important. As the second point in the format is the introduction that contains 3 points. The first point is the research problem. That is the statement of the problem. We have to mention the nature, magnitude, and significance. In previous knowledge and lacunae, we should know what we have to know, what we do not know, and what is needed to be known. In applicability of the result in filling up the gap, we should know why we are doing this research and what information we need for this research and what should be the outcome. Second is the research question, which is the backbone of the current study. It should be clearly and precisely formulated since the entire research is aimed to answer this question. A third is the hypothesis, which is done in experimental study. A third is the objective. An objective emerges from the research question. It has to be precise and smart. SMART here stands for specific. That is, we have to know who is doing this or what is the target population and what is being done to them. And it should be measurable. That is, we have to know how much change has to be uh, is to be taking place or what data is going to be used, where the data has to come from. In achievable, we have to know how to achieve the objective, or if any limits or constraints are there, how to overcome them. In relevant, we have to know our goals that we have to reach, whether it's worthwhile or and reasonable.
Sorry for interruption. Pooja, can you be brief, because this thing again it will be repeated by Dr. Neha again. So
Yes,
I think you should briefly tell the headings, let us speak, then again we'll discuss each point.
Okay, sir.
That will be better, I think.
Okay, sir.
Otherwise it's very lengthy.
Okay, sir. Now, T stands for time bound. The objective should be numbered and specific, and it can be primary or the secondary. Now, primary objective is a must have. It dictates the type of research we are doing, and secondary objective is an add-on to the primary objective. Now, fourth point is the methodology. It is the procedures that are used to achieve the objective. These include the place of the study, that is the geographical area, the study settings, that is the exact location where the study shall be conducted, the study period, that is the time period taken, and the phase-wise mention of the time period. The most important is the study design. This is of two types, that is observational and interventional. Now, observational is again divided into descriptive and analytical. Next is the study population, which is pooled out using the inclusion and exclusion criteria. Then the sample size estimation is done where the number of subjects that have to be kept in a group has to be decided using various statistical methods. Now, sampling techniques are of two types. One is the probability technique and the non-probability technique. Now, the study subjects are selected according to the selection criteria that contains the inclusion and the exclusion criteria. The study tools are the instruments used for the research. The techniques are the manners in which we should use the study tools, and if intervention, if any, done in the evaluation has to be mentioned in a detailed manner and in the order of occurrence. Now, study variables are the different components that are measured in a research. Next is the data collection. All the data generated is recorded in a detailed manner. The data management is done using computer softwares or statistical tests. The procedure of coding and analysis has to be mentioned in details. Now, data analysis is done using statistical tests that prove the significance of the research. Like for qualitative tests, chi-square test is used most commonly. For quantitative variables, ANOVA test is used, and the clinical significance has to be less than 0.05. In conflict of interest, if the interest is anything other than scientific, like if it's political, commercial, personal, etc., it has to be taken into account as it puts an element of bias into the study and affects the results. Next is the ethical consideration that is given by the Institutional Ethics Committee. Without the approval of the Institutional Ethics Committee, we cannot start a research on any topic. So it has to take into account the benefits and the risks to the subjects, the secrecy of the personal information of the participants, any reimbursement given to the participants in form of transportation
Since he has network issues.
Now it's, I think we'll stop here and we'll go to okay, she can't share, stop the sharing also.
Admin can do that, sir.
Huh?
Admin can do the stop sharing and put up Neha's.
Subhaji, can you stop sharing and we'll go to main talk?
Okay, sir.
Okay, thank you. So, Dr. Neha, now you have to start.
Good evening, everyone. Thank you so much, Dr. Subhiti, for that kind introduction. And I'm very sorry for the biodata. I should have shortened it and sent you. I just, sent what was saved with me. I'm sorry for that. I thank EIZOC for this initiative with IGO. It's very interesting, and I wish we had access to these kind of things when we were first year residents. So this is a great initiative, and I'm happy to see so many postgraduates here. Dr. Pooja, if she can hear me, then that was a wonderful presentation. I mean, I understand you're a first year resident, and probably I wouldn't be able to make such a good presentation like you have made.
Prepared in one day. Prepared in one day only.
Very impressive. I hope she can hear me. You're on the right path, if I may say so, towards writing your protocol. So I'll just start my presentation here. All right. So writing a thesis protocol. This is, obviously why do we have to all go through this talk? Why do we have to write a thesis protocol, or rather a thesis? It's essential for passing the MS or MD or DND examination in India. So in order to get this degree, you have to successfully submit a thesis. More importantly, or rather equally importantly, I would say, this is our first exposure to the scientific method right after our MBBS or our degree. So while doing our thesis, we learn not only how to research, but also how to write a paper, which may be the stepping stone for a lifetime in academia. Thirdly, even if you don't continue it, just your thesis itself gives you an opportunity to present and publish, to feel what it is like, and then maybe you can decide if you want to go ahead with a more academic streak in your career or not. And last but not the least, every research that we do does contribute to our community, contributes to our academics, and it contributes to further care of patients when we present it, when we publish it. On a lighter note, you all have to suffer, like we too suffered. Our guides suffered, we as guides suffered, and now our residents also have to suffer, but there is no way of escaping the thesis. So why not make the best of it? So my talk is divided into these subtopics, the selection of the topic, which is most important, writing the protocol, and I'll also briefly discuss what you do after you've submitted the protocol, how you start your thesis research work, a very bird's view of writing the thesis, and then finally what more you can do with your thesis. So the topic is literally the most important part of your thesis, and a good research question, what we say, should follow the finer criteria. First of all, it should be feasible. So it's very important to see what setting you are in. Will you get enough subjects for your study? Will you have enough resources or the technical expertise for your study in terms of the equipment, in terms of the surgery, if you're planning a surgical thesis? Will it be affordable in time and money? You cannot opt for a very expensive treatment unless you have some sort of funding. You should be able to see, will it complete in your time of say, even if your thesis time is 2 years, it has to complete in 1.5 years, depending on how much your follow-up period is. And is it manageable in scope? Again, with respect to the number of patients, with respect to the follow-up and the procedure which is being done. It should be interesting for it to have a stand in the academic community. It should be novel. Now, I understand it's very difficult to come up with a novel topic just when you have entered ophthalmology, but this is where your guide guides you. So by novel, of course, if you get some path-breaking research question, that is very good. But other things you can work on are, like usually your guide will have a particular area of interest or a subspecialty in ophthalmology, or would have done previous theses. So what you can do is discuss if you can confirm or refute previous findings, or if you can extend previous findings. Let's say there were some unanswered questions at the end of the previous thesis, or you can provide new findings by applying previous findings to a new subset of patients or extrapolating the treatment. Of course, it should be ethical, otherwise it will not be passed, and it should be relevant, which means it should be a topic which is of current interest clinically. So is it a hot topic? And what we say is the so what test. So your research should add some meaning, since most of us are doing clinical research and not just experimental research. So it should add some meaning to the clinical side also. So like I said, the thesis should be relevant and timely. So in today's world, doing a thesis on, say, ECC would not be as relevant as maybe a small incision surgery, which most of the practitioners are now doing. It should be a practical and doable topic. And like I said, it should build on previous research or expand knowledge. Let's say if there are a lot of papers on maybe femto-assisted cataract surgery, maybe you can take a subset in a set of complex cases or a different type of cases, and then study the applicability of that treatment modality. And of course, if you're lucky, you can, maybe your guide can help you to think of a question which is groundbreaking and cutting edge. And I always love talking to first year, second year residents, because, you know, they give a perspective which maybe we are not seeing, since we are so used to seeing what we are seeing. So let's say you find a technique that prevents PCO, and then things become very easy for you. So for this, it's also very important that you do a good literature review, because you might think that, you know, you've come across a very good topic, and if your literature review is not thorough, you might miss the number of papers that have been published on it. So a good literature review is very important. And in fact, not as part of this talk, but I also give a talk on how to actually search PubMed. Many times I've had residents come to me, I tell them to search a particular topic for a thesis, and they say, ma'am, there are only 3 papers or 4 papers. But if you have not searched the literature properly, you will miss, probably there are 10 or 15 papers on that topic. And then selecting that for your thesis becomes less meaningful. So both these things are important. You do a literature review, and then you brainstorm on what has been done and what has not been done. So these are some important criteria to define once you are selecting your topic, which for simplification has been compiled into the acronym PICO-T. So P is the population that you will be dealing with, the participants or the patients in your study. I is the intervention or the exposure that you will be doing, unless it's an observational study. C is a comparison group or a control group if you're doing an RCT. O is the outcome, which should be measurable, and T is the time, which is the duration for the data collection. So to summarize, while selecting the thesis topic, of course, the candidate learns research and clinical methods, but they should remember the feasibility of conducting the study within the available resources and the time frame. It should satisfy the statistical requirements in respect of the sample size and the proposed analysis of data, which we will just see. In studies involving humans, it should fulfill the ethical requirements and ensure that the same thesis topic is not being repeated. In fact, some universities ask for a disclosure or an undertaking that the similar topic has not been done in the last 5 years in the university, because it is wastage of resources. Now coming to actually writing the thesis protocol, and this is the highlight of the first year of residency. So this is the format of the protocol. You can see, and the approximate number of pages. can just screenshot this, or I'm sure everybody has this. So some useful tips before you sit down to write your protocol is, you should talk to your seniors, like I said, postgraduates of the same guide who has been allotted to you, to know the area of interest, to know how to work with your guide, to know how to have a rapport with him or her. Secondly, very importantly, you should involve a statistician very early on. You should not wait for writing your thesis results to involve the statistician. In fact, one of the thesis which I was supervising came back the protocol. Initially, I was a co-guide in that because the statistical calculation of the sample size was not written in it. So once your topic is finalized, even for calculating the sample size, you must involve the statistician. You must take the explanation of the sample size for them and write it in your protocol. A thorough literature search, like I explained to you, is very important. If you miss major articles which are relevant to your study, then your thesis will definitely not be meaningful if you are presenting it or publishing it. And some of the aids that you can use are PubMed. You should always use the mesh terms, Cochrane library, and please don't search on Google. Google Scholar is not as reliable as PubMed or Cochrane. Sometimes, there may be a slight difficulty in getting full text. So AIOS in collaboration with AAO has a lot of journals where you can get the full text if you are a member of AIOS. So we start with the introduction. In this, you should describe the disease that is pertaining to your protocol briefly. Then you don't have to go into the history. For example, if your thesis is on diabetic retinopathy, you do not have to start about what is diabetes and what are the changes diabetes produces in the body or in the eye. You start with diabetic retinopathy per se. This is the MD thesis. You discuss what is known already, what are the gaps, and you write how answering your research question would modify the current state of knowledge. The introduction should be in a paragraph form. In your protocol, please do not use bullets or subheading. Next comes the review of literature. Again, you summarize a bit about the disease under consideration, but do not go into very basic details about the anatomy, physiology if it's not relevant to your thesis. You summarize what are the available studies, what is already known about the subject. And then
Neha, sorry, can I interrupt you for a minute? There's a lot
Yes.
of background noise coming from somewhere. I don't know if...
no, actually, I think everybody's not on mute. It's coming from me also.
Yeah, so if everybody can just mute it, it'll be more clear what Neha is saying. Everybody can hear her well. Thank you.
Subodhji, take care. Please continue.
Okay. So after describing the disease, you summarize all the available studies. So in this, you should mention the authors or give the superscript of the reference of the studies which have already been done related to your topic. Because this will help you to identify the gaps in the knowledge, which will facilitate writing about the rationale for the study. So your ROL or review of literature should be comprehensive, yet it should be relevant. Like I said, please do not go into like signs and symptoms of diabetic retinopathy or the investigative modalities used. That is not required. Don't include textbook material, very obvious facts. List the literature in chronological order, and preferably the more recent it is, the better it will be. Give headings and subheadings so that it is clear for you and the person who reads it. And we'll talk about plagiarism a bit later also, but write in your own words. This is a habit which you should inculcate from day one. So for rephrasing, the best thing to do is maybe you read a paper, then you shut that window and then you write it in your ROL. Do not copy paste from there, because even if you change the structure of the sentences, the checkers will still pick it up. In the text, you should avoid the names of the authors. Like I said, you should use the superscripts for the references. So for lacunae in existing knowledge, many times, we get thesis for correction in which it is written, there is no data on this or no work has been done. So this is not an appropriate wording to use. Instead, you can say to the best of our knowledge, or there is paucity of data or things like that. Now about the references, I always tell the students that you start doing the references along with your review of literature or the introduction. Do not wait till the end that you have written the ROL and then you are going to do the references. That makes it much more difficult. So the Vancouver style should be used. This is the Vancouver style. You will get it on the internet easily. Even PubMed will give you the format of any article in whatever style you want. You can just right click and get it. Now cite only those references where you have read the full text. So don't do cross-referencing. I hope you know what is cross-referencing. Let's say you read a paper and in that paper some information is given which is from another paper and that reference has been given. So you cannot use this paper for the reference of that information. So you have to use the primary paper for the conclusion or the results that you are sharing. And you can obviously use reference managers like EndNote or Mendeley or Zotero, but personally I have never used, but I mean, you can give them a try. After this, we come to the aims and objectives. Now, what is the difference between aims and objectives? Aim is actually a bigger question or issue which you are addressing by your study. So what will be achieved by your study? Whereas the objectives are what you would actually be doing in the study. Like Dr. Pooja had used this acronym SMART. It should be specific, measurable, achievable, realistic, and time-bound. So how does this translate into an example? Let's say the aim of a thesis is assessment of the macular function in acute central serous chorioretinopathy. So this is the bigger function that, the bigger question that your thesis is addressing. How will we convert this into objectives? So let's say you have primary and secondary objectives. The primary can be to characterize the electroretinographic response of the macula by multifocal ERG in acute CSC and compare it with the normative database. So we have made it specific, we have made it measurable by multifocal ERG, and we have made it achievable, realistic, achievable and realistic, as in we have a multifocal ERG to measure this, and time bound. The secondary objectives can be to, let's say, correlate the multifocal visual, ERG with visual acuity, contrast sensitivity, and retinal thickness on OCT. So here you understand the difference and you have to write both the aims and the objectives. Next, we come to the materials and methods. This is again the most important. And like I said before, you should involve a statistician from day one of writing your thesis protocol. So these are, 10 essential information which should be present in your methodology: the study setting, the study duration, the study design, the sample size, and the justification of the sample size. So for the justification, you have to give your statistician a base paper. So let's say I'm doing a study, let's take the previous example on multifocal ERG in acute CSC. So if there is any other study available, the recent most or with the largest sample size, you have to give that to the statistician. Based on the results of that study and the power of usually around 80%, and then on the primary outcome measure of your own study, these three things are needed by the statistician to calculate the sample size and give to you. And this should be your sample size, and you should write this in your protocol and how you achieve this number. So I can't just randomly say I'll take 30 patients or I'll take 50 patients. You have to say that for a 80% power of the study, I need these many patients to get a statistically significant difference of, let's say, 10 microns on OCT or of whatever 0.1 millivolt or microvolt on the ERG. The study sample, the inclusion exclusion criteria, the method of selection or randomization, the intervention, if you're doing any intervention, you're putting an injection, you're doing a surgery, you're giving glasses, whatever you're doing, and you have to give the standardized intervention. The outcome measures, primary and secondary, the method of follow-up. So that means when will the follow-up be and what all will be done at each follow-up. Data management and statistical analysis, how you will analyze the data once you get it, and the ethical clearance, the informed consent. And now it is also essential to register every clinical trial, every RCT. In fact, even when you send your thesis to publish in journals and even IGO for that matter, it asks you for the RCT registration. Sample size, remember that you should be able to collect the data within a year, and only then you will be able to submit the thesis at 2 years, because you will have some attrition or, some patients will be lost to follow up, and you have a follow-up period as well. Statistical analysis, these are just, examples like I was telling you, how you should be able to write the justification of the sample size. And this is how you should write the statistical analysis, that how you are going to present the results, what tests you are using for the quantitative variables and what you are using for the qualitative variables, and if you are doing any correlation studies as well. All this is the basic essential information that should be there. Now, next we come to the consent. Basically, there are two in this. One is the patient information sheet and one is the consent form. So most of the medical colleges have this format already, or you can take it from your seniors. So the patient information sheet is what, as the name suggests, is the information sheet for the patient. So it should be in the vernacular or the regional language for the patient to understand, not just in English. The phone numbers of the investigators or of the person who's conducting the study should be there. A brief, just 2 or 3 lines about whatever procedure you're doing, or if it's an observational study, whatever tests you are doing. And if you are using a novel treatment method, it should also have a brief paragraph in comparison to the standard of care already present. Consent form, like I said, it has to be in the language that the patient understands. It's different for pediatric patients, and then for 7 to 18 years, you have a assent form. So this is like for MAMC, what we used to have, the informed consent form. You have to have the patient, the relative, then a staff and the investigator. And all these from day one, you should collect in a folder so that you don't lose them, and you also have the record. So coming back to the protocol format, we've covered all these sections which are necessary for you to write the protocol, and you must get the approval letter from your institutional ethics committee. This, again, the procedure varies for all institutes, but usually there is a meeting of the institution ethics committee where you have to present your protocol, and if they have any changes, they'll tell you, otherwise they'll give you the clearance letter. This, again, you also need whenever you are sending your thesis for publication. They all ask for the ethics committee approval letter. And this is your operating manual for the protocol. Now, some general instructions. See, proofreading and formatting is very important for your protocol also, and also ultimately for your thesis. If there are grammatical errors, if there are punctuation errors or formatting errors, it doesn't put a good impression to us when the thesis comes to us to be checked. So all pages should be numbered in the bottom center. Total number of pages, I've already told for the protocol, not more than 14, 15. Maximum references, 20 to 25. Use a standard font, and these are the font sizes which look okay once it is printed on a A4 sheet. Now, once you have submitted your protocol, I'll just go in brief about what next you should do. So from the beginning, if you plan your research work and if you monitor it, in the last days of submitting the thesis, you will have less stress. So, one of the early problems is getting the requisite number of patients. So this is what we used to do. We used to make these small chits of paper and write the major inclusion criteria and put it in all the OPDs, because, other doctors may forget to refer the patient to you. So let's say you are doing a thesis on amblyopia in let's say 5 to 10-year-old and applying a treatment method for that. So you can just write on a small paper, all patients of amblyopia, this age group, and isometropic or strabismus, kindly send to this person on this day at this time, and that will help you to get more patients. Another thing which I make all the students do is make a performa for each patient. So just on a sheet, have a concise case history, the name of the patient, the contact details, because if they're not coming for follow-up, you have to call them. Then whatever are your outcome measures at each follow-up, just make a chart that at baseline, this was the visual acuity, first post-op day, 1 week, 1 month, and this you put in a file, and every time the patient comes, you can keep filling it. You can side by side also fill your master chart, or which is the MS Excel. So again, in the end days of the thesis, you will not have loss of data or missing data, and it will become much easier. And finally, if you are relying on machines, like let's say OCT to put your data, or visual fields, or any of these, please keep collecting your data every week or every 2 weeks. So, you don't want any problem in the machine to take away all your data and all your hard work, and you start at zero. So the stages in your research work are collection of the data, organization of the data, then presentation of the data, which can be in tables and graphs, analysis of data, where your statistical knowledge will come into play, and finally the interpretation of the data. So this is one important thing I want to tell to all the postgraduates and residents over here, that the ethical principles should start from the planning and extend to the publishing part, and should be with you for the rest of your life, whether you are a resident, you are a clinician, or whether you are a guide. So this not only protects the participants of the study, but this is also to keep up the spirit of academics. So common issues are informed consent not being there, or you losing the consent form and then signing for the patient, then not maintaining confidentiality of data, fabrication of data or results. Let's say one patient didn't come on one follow-up, so you are tempted to just write the previous visits findings, but that should not be done. Actually, statistics has a solution for it, for missing data or gaps in your sheet, and you can talk to your statistician about it. Then falsification, changing numbers. Let's say vision is 6/9, you make it 6/12, and that's called falsification. And of course, plagiarism, which starts right from the ROL, when you start to copy and paste, or when you're writing your paper. So honest errors or difference in opinions are not research misconduct, but definitely any of these are, and you should stay away from them as much as possible. So never fabricate data, always make the graph of the data that you have. We've seen cases where the data is something else, and when we make the graph ourselves, it's actually different from what has been shown. Don't manipulate images like pre and post, and don't hide bad results, because even negative results are as important as positive results, and they just need to be interpreted and put forward in that way. So if you get caught, and people have got caught, you bring dishonor to your guide, to your college, to your university. So best to stay clear of all this. Now, writing the thesis has some additional topics in addition to the protocol, which is the results, like I told you, and the discussion. In this, you will need the help of your guide because the interpretation of your results will have to be done. Don't forget to write the drawbacks of your study, and finally the applications. Then you also have the conclusion, which is only of your study and not based on the review of literature. A final step in your thesis is the summary and recommendations, which should be a standalone, which means that if someone reads only the summary and recommendations, they would know what your thesis is about, what was done, what was found, and how it translates into clinical practice, and also what directions it gives to future research. This is another paragraph you can add in your discussion. So I hope some of my tips will be helpful to you when you actually sit down to write your thesis and you remember some of these points. Planning your time schedule is very important. Once you've written your protocol and submitted it, immediately you should start with the patient enrollment and data collection. And like I said, your data entry in the master chart should start almost immediately once you start your protocol. It shouldn't be only here. It should go side by side. This will also help you to get a real-time assessment of how many patients you have in your study, how many have completed, how many more you want. Otherwise, at the last minute, it will be you need 5 more patients or you need 10 more patients when you sit down and start writing it. So be aware on a day-to-day basis on where you are in your patient population with regards to the numbers. And then once the entire data is collected, then you start with the analysis, though you can come to know the trend before that also. I'll just talk about this in my last part about what more with the thesis. And so how you write is, after this, you write the results and then you write the discussion. And this is the approximate time that you should take for that also. Don't spend a lot of time in writing the review of literature. So a well-written thesis, or for that matter, a protocol, is concise yet clear. It shouldn't have too many long sentences, grammatical errors, or punctuation mistakes. Giving attention to details puts a good impression on whoever is reading it. So when you use an abbreviation, for instance, the first time you should write the full form in brackets, and you should also have a list of abbreviations at the end. The terms which are not in English should be in italics, and proper formatting is very important. The materials used for assessment, for example, if it's a questionnaire or a recording sheet, etc., these should all be provided in the appendix, which I had told you in the protocol format. Now, what more? This is the last section where I kind of give you a motivation of why you should spend time with your thesis and your protocol, and why you should give it proper consideration and not just keep it as a tick mark that you have to do to get your MD or MS or DNB degree. So your thesis is literally like your baby. Whatever topic you have done your thesis on, you will remember it even after 10, 20, 30, 40 years. In fact, even the patients that have been in your thesis, you will always remember them. And I am still following up relatives, patients of my thesis, which was more than 15 years back. So as far as presenting it, your thesis is concerned, be in touch with your guide. You can always present interim analysis, because let's say you find a research topic today. Today it's a hot topic. After 2 years, when you complete your study, others might have done research on it and might be presenting it. So once you have a considerable number of patients, you can always do a statistical analysis and present your partial results. And at the end of 6 months or at the end of 1 year, and that will not only give you practice, but also tell you which way your thesis is going. You can present at the state level, in state conferences, national, and even international. And once your thesis is complete, you can enter into competitive presentations like the AIOS gives the Young Researcher Award. And I was very lucky to have won the first prize in this in 2011. At that time, Dr. Natarajan was the chairman of the ARC, and AIOS very kindly sponsored a visit to American Academy of Ophthalmology, which was my first international conference. And in that way, it became very special and also a plus point for doing the thesis well. Coming to publications, one thesis does not mean one original article. You know, you have so many patients in your thesis. You can always make case reports. You can always make case series in addition to your thesis paper. And you can also make multiple articles on different outcome measures which you have given. So, for example, this was the first thesis I supervised as a guide in 2014. And this was the entire paper which we published in OSLI as an original article. But then, like, for instance, there was one patient which showed a very unique pattern, and we published that as a case report as well. So it's not necessary that you only publish the complete paper as an article. You can take out other publications from it as well. This was my thesis. In fact, there was my thesis was one of the first on Avastin in 2006. And there was one patient which in fact developed a complication in the thesis, but that was also published. And this paper is still cited because it is an important complication, though rare, which still people need to know. Similarly, this was another paper I took out from my thesis. So thesis, if done the right way, is not a burden, is definitely not boring, and maybe the beginning of a career involving research if it's something that you like. And it can definitely take you to new heights. So with this, I end my presentation. Thank you all for your patient hearing. I hope I have been able to help you, maybe been able to inspire you. Since there are a lot of residents here, I'd just like to show a snapshot of our book on clinical trials in ophthalmology, which will definitely help you in your exams, and you should have a look at it as well. Thank you.
Excellent, Neha. I think that was very, very lucid, very crisp, not a very long drawn thing, theoretical, very practical points. I think you've given all of them. And as you said, this is very, very useful for the residents who've just joined. And I think if we can, share a recording of this with the new joinees, it's definitely going to help them prepare a better thesis protocol, which will, get through at the first go itself. I'm sure a lot of you all have already made your protocols, and if you all are having any hiccups, I'm sure Neha will be able to help you all out, iron them out. So any questions, I'm sure Neha will be happy to take. And I'm sure Dr. Prafulla is handling a lot of residents and JRs, so I'm sure he'll also have a lot of inputs. Anything specific that you'd like to add?
Thank you, Dr. Neha. It was a wonderful presentation. So as Dr. Chaitra said, we are handling 133 MD students per year currently at RP Center. So I would like to ask few practical questions, because whatever you presented, yes, that should be the ideal way. But the practical problems that a resident encounters while doing thesis, first choosing a novel topic. Now they are newly introduced to ophthalmology, they don't know anything about the topic, and at RPC you have to submit your thesis protocol within 4 months of your date of joining. And I'm sure all the institute, they have must have some policy. So how to choose a novel topic when you are completely new to ophthalmology? That is one. Second, sample size. What we have realized here, that the student comes up with a novel topic, but the sample size comes out to be 500 or 600, which is not feasible. Then how to tackle that? Third, what we realized during COVID time is there's a lot of patient losses. Like your target was 400 and you could get only 50 patients. How to tackle that problem? What are the options for the resident for that? And fourth, which is a problem which often students don't express, but few of our students, they do express that I want to change my guide. So is there an option to change your guide midway if you don't like that, or the going was not good between the two? And a fifth point, while presenting the data, like statistics, do they need to know everything about statistics? And if they just need to learn some basics, then what book you would recommend? Or are there any sites, because everybody doesn't have the access to like all these ICMR sponsored webinars, all this thing? So is there any book that they can follow? That is, I think these are the few practical points that we come across while doing thesis with our students. And in fact, just to on a lighter note, nowadays our professor, they are sending a special request, because I look up to the thesis allotment, please don't give me candidate this time, because now they are also running out of the novel ideas. So I think I would request Subudhi sir to pass on these questions to all the respected members. I think they can give their opinion how to approach all these practical issues. And yes, last one is timing. The student, they don't give specific or a time that is reserved for doing thesis. They have to do thesis simultaneously. They have to look up the clinical work. They have to do the exam preparation, all these things. So how to tackle all these issues, practical issues, while doing a thesis?
So if I may say something, which some of which I covered, but about the thesis topic was the first thing. So when I joined MS, my seniors told me very jokingly, when I was so tense, topic mein kahan se dhoondu? I don't even know what is OCT, what is this. They said, no, actually, the guide has already thought of the topic and they are just making you work so that, you know how to work. And I also felt that was actually true, because on the last day my guide told me that, why don't you look up this topic? And after 1 month of me losing sleep. So that is one thing. You guide who already, like I said, who's already kind of doing a series, let's say, who's done my guide was doing medical management of DME, so he had already done IVTA, he had done vitrectomy, and the next logical step was Avastin. So if you know the previous thesis the guide has done, you might get an idea. But that being said, when I became a guide, I actually realized that talking to first year residents, you are right, they don't know anything about ophthalmology. But that's the best part, because that's where the thinking out of the box starts. We are so used to our clinical work and reading the same papers and listening to the same things in the conference that we lose the novelty. But sometimes just talking to a resident about something can help the guide also to get ideas. So that rapport is very important. I'll ignore the question that you said about changing the guide. At least in India, I don't think it's possible. In US, it's a very common thing and it's completely possible. But I don't think it can be done here. And other thing I wanted, I'm sorry, what was your second question?
You have a novel idea, but sample size is too much.
Yeah, so that actually the statistician can help you. Now, what I told you, the 3 requisites for the sample size are the previous study, the outcome measure, and the power of the study. So previous study outcome and the sample size you can't change. but you can change your outcome measure. So for example, if your outcome measure is visual acuity, OCT, and let's say IOP and or 4 things. So for visual acuity, the sample size might be much more, but if you choose another outcome measure, your sample size might come down. And this is a trick that I have used many times, not just in thesis, but in papers also. So if you tell the statistician that this sample size is not feasible, you change the outcome measure, they will be able to do that. And that you don't change the outcome measure, actually, you just make it the primary outcome measure. And the remaining things you make the secondary outcome measure. For example, I was co-guide for a study on amblyopia and that atropine and amblyopia. So when they were using visual acuity as the primary outcome measure, the sample size was about 500 because all the previous studies had used visual acuity. But when we changed it to contrast sensitivity, our sample size came down a lot. We still did visual acuity, but we made that a secondary outcome measure. So please try this if it works for the sample size. Remaining questions.
So the sample size calculation is primarily based on your primary objective.
Yeah, that's one of the key. Yeah, because power of the study, they'll always use 80%. It has to be 80%.
Another good example that I would give to you is MUT trial, myotic ulcer treatment trial. The primary outcome measure in that trial was visual acuity. But we all know for a keratitis case, the outcome measure should have been culture negativity or healing rate. But they took visual acuity. By that, they could reduce their sample size. So that is one trick. And any other suggestion from panelists?
Dr. Chandana? Dr. Chandana? Chandana madam?
Yes.
How to tackle, ma'am, the problem of loss of patients? For example, COVID came suddenly and most of the residents struggled to complete the mandate. So how to...
So I don't know, during the COVID period, that was a real problem. I do not want to reveal what has happened there during that period. That I don't want to disclose. Everybody knows what has happened to the thesis.
But if something like happens, what are the
options? Being a thesis guide, we just told them you manage it. I can't tell them that you do pani misao or something else, but I gave them full liberty that you have to manage it. So that was the thing, but that is not the normal way. Now thing is changing very fast. So I have I am going to tell that writing the protocol, you write the protocol. I will tell the juniors that you write the protocol and then you show it to some of your seniors and some of the faculties. And after that, you submit the protocol. And in many of the institutions, like in our time, we had it in RP center that you have to present in front of a full house. So that from there, they will critically analyze it and they will ask you to do, these are the changes you should do. But this thing, I think that in all the teaching institutions, they should have this type of thesis protocol presentation. So that will help a lot. I guess many institutions, they don't have this thesis protocol presentation. That is one. And change of guide. Change of guide is a problem even in our government institute because we have the options like many times we are just transferred from one to another institute. So that time the PGT, they are in a real problem. But they can continue as we are in the same university we are working. So they can always come to us and contact us. Ma'am, what will you do? Maybe that I have gone to another institute, but they can always contact us. So that is there. And a few other suggestions like during review of literature is one thing which should be done first. Before that should be done first. And the review of literature should be presented in a table format, like author, year, like this. So that will be more means crisp presentation of your protocol. That is there. And another thing is that reference that already Dr. Neha has told that it should be the recent references. Recent references. Recent means 10 years like this. But sometimes there may be such thesis topic that you may have to go back to old references also. That is there. And lastly, I will say that you should have a good rapport with your thesis guide always. That is very important because otherwise they can give you trouble a lot. So that many of us as my guide was good, Dr. Ramanjit Shihota. She was a very nice lady, But otherwise, many times the guide gives a lot of trouble. So you have to you have to find out how you will just please them or keep a track with them or keep a rapport with them. That is your duty. You have to find it out. That's all. Thanks a lot for including me in such a webinar that is very close to me.
Sarmishta, would you like to say something, Dr. Sarmishta? Dr. Chandana has already told about
yes, I would like to say that in our institution, we have a thesis protocol workshop and our students present it in full house. And it is discussed and the sample size is set and then the study starts. But sad that actually we are not putting in much effort towards the thesis. Maybe this the present award that is put up in the state will encourage students to work truly towards the completion of the thesis.
Thank you, ma'am. One thing I would like to add here. If you are not able to complete your mandate, so far the sample size is concerned, at RP Center, we do have a mechanism. You can write it to the ethics committee and you can get your sample size revised. But you have to give proper justification. So during COVID time, almost all our students, they got their sample size reduced from 20 to 10 or something like that. So that is an option, but I don't know whether other institute do give such options to the students. But that must I think the best way to deal with such problems.
I think COVID was unprecedented and most likely it's not going to happen again.
Exactly.
Obviously, this is made a habit. Then every year they will have like 100 applications of reducing the sample size. But then thankfully, COVID should not. I mean, I don't want to say.
But my take is that before taking a topic of the thesis, you should also see the number of cases coming footfall in the OPD of a particular institution. Even RP Center also, we see the number of cases that are coming to the OPD. Unless a good number come, you cannot give a high number sample size to a student.
Yes.
The number two is that in the beginning, you should not give the topic to the student. Actually, let them choose 5 to 10 topics. Come up with 5 to 10 new ideas. Maybe they may have the brilliant idea as Neha was telling. If any good idea is coming, let them pursue it further. Then they will own the idea. That will be very good. And then the protocol, how to write. First, you need to go to the statistician, very well said by Neha, in deciding the sample size. But here again, the primary outcome measure and secondary outcome measure will decide what is the sample size. That is where they need to decide about the thesis. In India, I don't think anyone will comment about the guide, but there can be a younger co-guide, means younger faculty who is a co-guide, which RP Center very well practices. Is it there, Praful, now, or it's been abandoned? Only a guide. Guide and co-guide used to be there before.
Yes, sir. Nowadays, there is one guide and at least 4 or 5 co-guides.
It's always better because certain times guide is very senior person and the junior means first year postgraduate cannot approach the guide. So co-guide is someone who is very younger and very friendly with the students. So that way they can approach the co-guide, and whatever doubts they have, they can. And while thesis protocol by itself, at the presentation, it is thesis protocol. Here actually the Neha presented thesis presentation, how to finish the thesis also. But here you should have stopped at the level of the protocol. Protocol is something different from the thesis writing. Certain times at the time of protocol presentation, you should decide whether it is doable protocol or it's not doable protocol. The student may end up with non-doing of the thesis if the protocol is not proper. So this also need to be decided. Actually in RP Center, what we used means there used to be a meeting, and certain times they refuse the protocol altogether. Did anything happening these days, Praful?
Yes, sir. This is happening nowadays. And nowadays, although they don't change the topic, but they ask to modify their outcome or maybe revise the target they have set for, or the inclusion criteria. Some modifications.
Yeah, those modifications do happen, but we at that time it was very strict actually.
Yes,
the feasibility, everything has been totally thoroughly studied by all the consultants, and they may say that you don't take up this topic, but you take another topic.
One thing what I can add is now we have started is because for students it's often difficult. Once you give them topic, they don't come back to you till the time of their presentation. So 6 monthly thesis review, that can be.
Yeah, that can be done. That is very good idea. Actually,
yes,
this should happen between the co-guide and the student time to time, so that how much they have come up in this thing, and there should be a time, specific time allocated to the student for the purpose of thesis. This is very, very essential. Actually, one of the questions Praful has asked is, how do you allocate the time? Usually what we used to do, RP Center, we have 3 days. I think even now it is there, no? OPD, operation theater, and off day, like that. And off day also, after the rounds, there will be free time for the student.
Nowadays that off day is gone. It's like OPD, round, and OT. So they don't get time. It's very difficult.
It's very difficult. We used to have half day. So this half day we used to go, means weekly 2 off days we used to get. So these 2 half days we used to get, we call the patients, because all the patients, whatever components of your study you need to carry on when the patient comes to your OPD. So call them on a specific date, give them time, and then conduct all the investigations that you need to be. And you may have to circulate your thesis in very precise way to every consultant and every student as well, because your students who are colleagues can send you the cases which are specific to your thesis protocol.
I think Dr. Neha rightly highlighted that. You have to paste in all the OPD.
Yes,
yes. If you find, please send it to me.
A lot of friends can help you. Otherwise, it's very difficult. Second, active consultants who are likely to help you is also, they also should be approached with your topic, this thing. And time to time, you need to remind them. It's not that you pasted there and then it's forgotten.
Okay. Can we go to the students?
Let us listen.
Dr. Pragya Panda, do you like to say something?
What problem they are facing?
Dr. Pragya?
Students, they will not tell everything here. No, but
let other panelists let us speak. Dr. Pragya?
Yes. Yes, sir. Sometimes there is a problem with the thesis is that the students, they submit the synopsis and then they forget about the thesis. Then again, after 1 year or 1.5 years, when the time to submit the thesis comes, then everyone is worried and then start writing speedily, and there was no time for correction and no time for proper evaluation of the things.
So if
Sometimes,
they forget the whole year, how can they write a thesis?
so that was a good suggestion, that 6 monthly thesis review. So that is a good thing. So we
That
should
is official
review it
review, but every month they should.
every
Actually,
month.
yeah, yeah, yeah.
Yes.
We used to have very rigorous. My co-guide is Dr. Maipal Sachdeva. We used to meet every month almost, and my guide is like VK Dada.
Okay.
I used to go to his OPD and used to tell him this can be our thesis case, this can be our thesis case, and we used to
Yes,
select that.
yes. The idea of to paste the thesis topics in the OPD, that is also nice. So we can follow that idea to all the first year students. They should paste the thesis topics in the OPD.
So any of the students who have already received the topics, can you say something about your topic? Discuss with the experts.
Difficulties that they are facing.
Also, if ma'am, I might just say like 6 monthly, what Dr. Praful said, but also like whenever there's any state conference or DOS or AIS, then you just tell the residents that if you collect your thesis data till now and send it as a paper, you will get
That's a good
academic
idea,
leave to present there. So then also they will get the motivation to
That will make them commit to get some
present
real
it.
data.
Yeah.
The students can come up with
They
the
have
problems.
Any questions from students?
Few of the discussers, they have sent me some questions. So I would like to read that.
Yeah.
And our panelists, they may answer that. How to choose a topic being a beginner? I think we have already discussed that. Which kind of methodology is preferable, prospective or retrospective?
I think
This is from
Chaitra,
Dr.
you can tell the order of priority in studies. Of course, some studies are very, very difficult, but order of priority, top priority studies, and what is the least is case report that everyone knows.
Actually, it depends. See, in each journal, it changes the priority. Like if a journal doesn't even take case report, it doesn't matter. So it depends. And in sometimes even as small as a letter to the editor can have a lot of impact, because if you're writing about a major, side effect or a new side effect, even something as small as a letter to the editor can have a huge impact.
Last meeting we have told that unless it is a high impact case, again the value is.
Yes,
you need to say the 90%. If they carry value, then you say this is a valuable methodology.
Absolutely. So the meta-analysis are the systematic reviews are the highest form of any paper that you can write, which gets a lot of citations. Therefore, it adds to the value of the paper. In fact, there are several tools wherein you can see the impact of an individual paper also on your own, citation values. So there are multiple tools that are now available, multiple metrics. Some set of papers that one wrote probably 10 years back may not have as much as an impact that you've probably done in the last 5 years because the quality of your work has improved. So there are scores that will give you your contributory, metrics in the last 1 year as well, based on the number of citations you have. So it's nice to keep yourself updated to know, if you're actually going in the direction that you've chosen. And like Sir mentioned last class, last series, the first of the series, we actually discussed on the different types of, articles and how to go about and what is the importance of a case report as well. And in the subsequent, seminars, we will be talking about the different kind of articles and how to write each one of them more in detail. We just did an overview last time. Now we'll go more into detail of each type of paper.
This is one interesting question. I think this is quite relevant too. For an institution which might not have high-tech facilities, what topics should be good for choosing a thesis topic? I think Dr. Neha rightly said that you have to depend on your guide, because your guide is there in that institute. They understand what are the things that they can do. So it's better to rely on that. And one more question from Dr. Tasrifa. For an area with tea gardens, can we go for any community-based study? I think you are from Assam, Dr. Tasrifa. So can we go for any community-based study? If possible, what topics can we go for tea garden? Anyone would like to?
I think it's actually interesting, because first of all, they've come from a completely different geographical area. Their profession is different. I think they also have a lot of seasonal variations. And probably one interesting thing that you could look for is what is the trauma if they sustain anything, whether they have any allergic thing, because there'll be a lot of pollen. This is something that you can look for, some sort of an allergy if they have. And also they'll be using, chemicals in terms of fertilizers and for spraying to kill insects, insecticides as well. So whether they have any corneal surface issues, I'm just, thinking randomly, but I'm sure Madam Dr. Chandana has a suggestion.
Actually, I was in North Bengal Medical College. So that time I had some experience to visit some of these tea gardens. And what we used to do is that with some other different means ENT, skin, community medicine, all of us, we went to these places of some of the tea gardens. The one very important thing from the eye point of view, that is the trauma. Because in the tea gardens, they have various instruments. Instrument means machinery. So machinery and various specific areas where they used to work. So what type of machinery or where he or she is posted at that particular time and what type of trauma is they are getting. So that we have seen. And that another thing is that they are children. What are the diseases these children are getting? That is another thing. Those who are residing inside the tea gardens. One is trauma, one is this type of means they are basically these are poverty. There's a full of poverty. They have to go through the poverty. So they are exposed to many such diseases which are common to like bitter spot, vitamin A deficiency. So that is very important. I remember I have seen patient who had the child 5 years who has lost both the eye because of these keratomalacia. So these are the things should be picked up if you go there and do this type of this. And these are very rare actually. If you have any you can go and you can do very good study.
Doctor, I think Dr.
Literature review also can help.
Yeah.
Because any studies done previously also on tea garden workers, there also you can get recommendations, what they have observed and what direction for future studies. Also you can get from literature.
But these studies are quite impactful. Don't think that these are nobody will appreciate this. People would appreciate such works. Dr. Sriya, you wanted to ask something, no? So you can ask directly.
1 minute, if I might just say something to add. Very nice ideas by everybody. If you just need to like convert it into a scientific question, you first of all, you can probably do a cross-sectional study, let's say, if we try and characterize, because it will be difficult to do any intervention in this population. So what you can do is do a review of literature. Like Madam said, there's incidents of trauma, like Dr. Chaitra said. So, you can make a questionnaire which you can present to each of these, and then you can analyze the answers that you get and write that in your discussion. And you might come up with, what is, say, the healthcare gap in this region, or maybe the time they take after they have a trauma to reach a facility. These are the kind of say points you can take out for discussion. But this would, to my mind, be a cross-sectional observational study where you can go with a questionnaire and then have the answers, because otherwise to go in the tea garden and even measure their vision or even check them with a handheld slit lamp, and how will you get them to your hospital? So for a community-based study, you will have to have a questionnaire where they tell you and then you analyze what they tell you.
Yes.
So for that, you can form the questions accordingly.
Thank you, Dr. Neha. Asriya, you wanted to ask something?
Yes, actually, I wanted to know whether there is, first of all, I wanted to know how to calculate power of the study. As mentioned by ma'am, I wanted to know how to calculate power of the study.
So you don't calculate power of the study, you set the power of your study at something. So basically power means what is the power of the study. So let's say my study has 100% power, which means that there is no chance that my results are wrong or my results are there by chance. So that obviously cannot happen. So you cannot have 100% power of the study. 90% is also very difficult to achieve. So it's usually set at 80%, what we call the beta error. So it is set at 80%. What this means is that if, let's say, there are 100 studies done, then 80 of them will not be by chance and 20 of them might be by chance. So the power of your study is set at 80%. It's not something that you calculate. So less than 80%, if the power of your study is set at, then the relevance becomes lesser. So the minimum the statisticians use is 80%.
Power helps in deciding sample size.
Power of the study to get 80% power, what should be the primary outcome? What should be the secondary outcome? If you suggest, then the statistician will give you the number. And if it is not relevant, you should see at the same time that what is the alternative way you can reduce the number.
One thing I would just like to extend one question to this. At times you may not have previous studies, like when you're calculating power of the study, you said you need a previous paper or something like that. Suppose some topic is completely novel and there is no study published on that particular aspect. So how to go about that? What are the things that the candidate must know before calculating the sample size or before going to the statistician?
So what is recommended is doing a pilot study, let's say of, just 10 patients usually, the pilot study is done. And those results are then used to calculate the power. But I don't think I've ever met any statistician who has, at least in ophthalmology. I know there was a paper in radiology which was published which said there's no review of literature because this has never been done before. But in ophthalmology, usually you get something similar, or at least you get the disease which is similar. Like the radio paper I'm talking about, they had invented a new machine to do something. So there was no ROL even. It was so novel. But in ophthalmology, since we are usually dealing with diseases, so the disease papers are always there. And like I said, I haven't come across, but you can always do a pilot study with, say, 10 patients, they say, for pilot study, and then use those results as the primary paper. Also, Dr. Praful had asked about statistical analysis. How much should one know, where to get the information from for residents? So like Madam said, some colleges like even Maulana Azad used to have, and even DNB conducts for that matter. They do a basic workshop for thesis protocol, and in that you can learn about statistics. AIOS or any conference usually has a session on research methodology and statistics and all, and that's a good way to just hear and maybe pick up some things as well. And it's always handy to learn how to do basic stats with just MS Excel. I learned it off Google. I'm sure you can. So, when, like I said, you have to present in a conference or somewhere, you can always use that. And it helps you understand what your statistician is saying, because sometimes you don't even understand what they are saying. So these are the tools you can use. As far as the book is concerned, we used to read a book which was called To Study a Study, to Test a Test. And I would recommend that too if you have interest in statistics.
I think we are over with questions.
There is a book actually, Piyush Bansal. It's a very good book that you can go through. And another thing is that regarding this research methodology and all, actually nowadays there is a clear instruction that all the PGs during the junior residency, they have to clear the exam of that basic research methodology. So they know actually better than me. Sometimes I feel they are answering better than me because they have already gone through that. Most of you have cleared that basic research methodology, that exam. So they are answering well, and they are only the statistical analysis, the study design, everything is given.
Thank you, ma'am.
So thank you, everyone. Dr. Santosh. Dr. Santosh, are you there?
Yes, sir, I'm there.
So you're
Listening to everybody.
now
You
you
want
take out
to
from
stay
everybody.
dark. If everyone turns on the videos now, we will be happy to see your face at least, right?
Yes,
A lot of people are video off.
I see. Dr. Santosh, your comments.
Comments? No comments, sir. Already everybody commented so much. Thanksgiving, if you ask me, I think.
Yes, you can give vote of
It's time
thanks.
to give thanks.
Again,
Before you give the vote of thanks, I think there is still, I think, one small video to play. Our hosts entered pharma, the formality. So
No, I have 1-2 questions for Dr. Neha. Number one, second. First thing is, she said that she is not using any reference manager. Then how are you doing that referencing?
Sir, I'm old school. I use paper and pencil.
Okay.
me too.
The second,
For survey articles also.
Yeah, I'm very old school. I have folders
I
and
used to be also
subfolders.
old school, but survey article, no, then I had to use Jotero. Jotero is quite
because that
It's
helps a
very
lot.
user friendly, but
Because
to be
the
honest, I
problem
don't
is-
even use the phone for other work. I'm still a paper pencil person. Like ROL also, I write down with paper pencil and then I type it into my computer. Somehow my thoughts are faster when I'm writing rather than typing.
No, the problem is when you change your sequence, then that becomes a problem in doing manually.
Yes, I have some papers with me. I can show you, but I don't want to because that is not the correct way. But I have my own way of just write. I actually write a summary of the paper next to the reference. So and then I change the numbers. It's all very complicated. But I would have loved to use a reference manager. That is what I said. But somehow I couldn't get comfortable with it. By the time I had already written too many papers, by the time I came to know that these exist, so I had formed some own way of my own.
Already had the
Yes,
experience.
but I've heard that Zotero is quite user friendly, and I think in RP Center also a lot of people use it.
it's free and also it's quite.
The second thing that I want to ask is, you said from one study you can have different papers basing on your study objective and other thing. But what they said is a salami publication. So what exactly is the difference between the two?
Yes, you are right. So, like to give an example, I supervised a thesis on, let's say, pre and post silicone oil removal, and we looked at the functional assessment of the macula. But we also did a objective assessment of the macula, and we also correlated the two. So you can do a separate paper for the functional assessment.
But not on the same sample and same.
Yes, you can mention it in the paper. You have to mention it. That we always mention. And if you have, say, two groups, like one thesis we did was on CSR, let's say laser versus observation. So then the groups become different. So I didn't do it, but you could have done it. You can publish the observation group natural history of CSR separately. And you can publish, say, whatever treatment you use, results of PDT separately. So there are two separate groups. You have what you had as the intervention and what you had as the control group. And then so in fact, for a lot of large multicentric studies and RCTs, the study population remains the same. I mean, even for say DRCR and all, from the same population, several results are taken out. For a lot of the AMD trials, the Pronto, Harvest, all of these, first they publish the 5-year results, then the 7-year results. So all you have to do is mention in your paper that, and you can also mention that the study population has been elaborated here earlier. So to my understanding, the salami publications are where, the information given out in the two papers is not different. So if you have new information to add, you can even use a previous subset and just extend the follow-up and give your new findings. I think maybe Dr. Chaitra can add to this if.
Yeah, so basically what Dr. Neha is trying to tell is that the data set also that you're using and your salami slicing is very less. Like see, for example, the difference between the two papers could be two patients. You can't just add two patients and say, you know, this is the findings. Or you can't say one paper is a 3-month follow-up, the other one is a 6-month follow-up. It doesn't work like that. So the data set is also very, very small. Whereas when you're looking at multiple outcomes like the DRCR, each one of those had different outcomes, different study question. The study question itself is so different in each one of them, whether you're looking at steroid, you're looking at anti-VEGF, you're looking at laser. So each of those papers had a very, very valid conclusion as against salami slicing, where the line is very, very narrow there, the difference. So that would be one major difference between the two.
Just one question to add, if time permits. Is it allowed in all the institute to get a thesis published or presented before it is being submitted to the dean or for approval? Because at the AIIMS, even though few people do that, but that is not allowed. You cannot publish any data out of your thesis till the time it is approved by the sub-dean. So I don't know if it is
No, that is not correct. For Maulana Azad, at least I can say. And in fact, we were encouraged to do it. And we were told we can write. And even for DNB for that matter, they ask you in the performa in the end that have you presented it anywhere or have you published it anywhere? And in fact, you can very proudly state it on the first page that, you know, this thesis has been presented in part at whatever, AAO even or URETNA, whatever. So there is no
presentation is allowed, but publication is not.
Not the whole thesis.
Yeah, in part you can always do. Like I said, if you have a case series coming out of it or a case report coming out of it, you can do it.
You can.
Because recently in our last annual conference last year, one of the faculty from one of the institute in Delhi, he called me that don't let this candidate present this pre-paper because he hasn't informed me that he's presenting this. So
that is a different thing. That is the guide and student, rapport that they haven't informed.
If you're presenting your thesis, please have a discussion with your chief guide and then only present it.
Yeah.
No, those are the things which can happen at any level. We have seen in AIS a lot of controversies actually. But that is the understanding between the guide and the student. Nothing to do with the thesis.
Publishing is, I think, not allowed. At least AIIMS they don't allow because they haven't approved their data, so you cannot publish it.
Subodhji.
At Maulana Azad permits.
Yes, sir. Yes, sir.
Hello, Subodhji.
Yes, sir.
Yeah, please play your video.
Okay, sir.
So no voice. Audio is missing. Subodh.
That video is too fast and clear.
Audio is missing.
I think you have to replay it.
Dr. Santosh.
Yes, sir. Can I
Yeah.
can I start the vote of thanks?
Yeah.
Yes.
So thank you, Dr. Subudhi, for this ongoing program where we all are learning. You are the chief initiator for this ORPI program. I would like to thank President, Secretary, and Chairman Scientific Committee of EIZOC to give us this platform. Today's presentation by Dr. Neha was excellent, and our student also presented, Dr. Pooja, Dr. Chaitra, my friend, who is always with us to guide us. Prafula was definitely gave us very good inputs, and our panelists, Dr. Chandana in particular, Dr. Samishta, Dr. Pragya, their inputs were really useful to all of us. Last but not the least, our advisor, Dr. Ajit Babu, who is always the force behind and entered pharma to provide the platform. So I'm still happy to give the vote of thanks at the end because I'm still learning. So thank you all, and we can close the session with permission.
Thank you, Dr. Neha. Nice presentation.
Good night, all of you.
Thank you. Good night.
Thank
Good
you,
night,
sir.
all.
Thank you, everyone.
Bye.
Good night. Thank you all.